All right, Dennis, let's talk about that masterpiece of a schedule that you built for today. It's perfectly blocked, it's productive, it's efficient. You look at it in the morning and think, yes, today is going to be a great day. And then life happens. That first patient strolls in 15 minutes late. The next one wants to hold you hostage for 20 minutes, talking about their vacation. A crown prep that looked straightforward on the x-ray suddenly turns into a surprise root canal. And before you know it, you're 45 minutes behind and your team is getting stressed, your waiting room is full, and that perfect schedule is a distant, painful memory. We have all been there. Feels like our day gets completely hijacked and we spend the rest of it trying to just catch up. But what if the problem isn't those individual events themselves, but our failure to have a game plan for when they inevitably happen? I believe the number one reason that dentists consistently run behind schedule is that we fail to proactively control our day by not identifying and managing the inevitable time sucks that try to derail us. Today, I'm going to give you a framework for taking back control. We'll talk about how to spot these situations early and how to tactfully manage them so that you can protect your day, your sanity, and your practice's profitability. Every single day, there are a few key situations that have the potential to steal your time and destroy your carefully planned schedule. You have to learn to spot them coming, and they generally fall into two main categories. First is the patient-driven time suck. This is the patient who shows up late, expecting their full appointment time. It's the incredibly chatty patient who, while lovely, can talk you right into running behind. It's the patient who questions every single thing, complains, and demands all of your emotional energy, often for non-productive issues. And it's the highly anxious patient who their fear understandably slows everything down. The second category is the procedure-driven time suck. This is that unexpected complication, the extraction where a root tip fractures, or the crown prep that goes subgingival and it just turns into a bleeding nightmare. It's the one more thing patient, the one who asks you to just take a quick look at another tooth after you finished all your planned work for the day. And it's the simple technical failure, the impression material that doesn't set right, or a piece of equipment that glitches at the worst possible moment. Your job isn't to be a victim of these situations. Your job is to become a master of managing them. This requires developing kind of a sixth sense for your schedule, anticipating problems before they fully materialize, and having the confidence to make tough calls in the moment. For the patient who arrives late, your front office team needs a firm but polite policy and script. It's not about being rude, it's about respecting the schedule. Something like, hey, Mr. Smith, thanks for coming in. Since we're 15 minutes late into your schedule time, we may need to adjust what we can get done today, or perhaps find another time to ensure we can give you the proper care without rushing. This gives you options and immediately sets a boundary. You contain the talker. You can use your assistant as a partner. They can politely interject with, Dr. Smith, your next patient is ready. Or you can say, Mrs. Davis, I love hearing about your trip. I just really need to focus on this next step to make sure it's perfect for you. But please tell my assistant Sarah the rest of the story while I work. It's a graceful exit, but it keeps things moving. You need to be a little tactful, but having a strategy will help you navigate those complicated situations. Now, here's a special kind of patient-driven time suck that can be a real landmine: the complex new patient exam. A patient comes in with dozens of questions, a full mouth of problems, and wants you to diagnose and present a comprehensive, life-changing treatment plan on the spot, all within a quick appointment. Trying to do this on the fly will almost certainly make you run late, and worse, you'll likely do a poor job of it. This is your chance to pull a different kind of ripcord. You need to buy yourself time to think. You do this by gathering more data. Take an intraoral scan, take more x-rays, take diagnostic photos or impressions. Then you say, hey, Mr. Smith, you have a lot going on here, and to give your case the detailed attention and thought it truly deserves, I want to take some time to study these records. Let's schedule a dedicated complimentary consultation for early next week where we can sit down together and review everything and go over a comprehensive plan that's just right for you. You've turned a high-stressed, rush situation into a premium, thoughtful experience. You bought yourself time and have elevated the patient's perception of your thoroughness. Now, let's talk about managing the procedure-driven time sucks. This is where you have to learn to pull the ripcord. This is a crucial skill. It's the predetermined mental point where you decide that continuing to struggle with a difficult situation will cause more damage to your overall day and potentially the patient outcome than stopping and regrouping. Here's an example. You're on a nightmare crown prep. You've been fighting bleeding for 20 minutes trying to get a good impression. The clock is ticking relentlessly. You must pull the ripcord. Just stop. Place a well-made temporary. Then you calmly say to the patient, you know what, Mrs. Jones, your gums are really inflamed and bleeding today. For us to get a truly perfect result, which is the only result that I want for you, I think it's best that we let this heal for a week or two. We'll have you back for a quick and easy final impression, when everything is calmed and healthy. And you just turned a stressful struggle into a controlled, quality-focused decision. Now, it's never ideal to not finish a procedure or hurt your production, but there comes a point where you need to make a decision to preserve the day. You should also try and learn from that experience so the next time a similar situation comes up, you can handle it better without having to bring the patient back. Now, here's another one. You're prepping a deep filling and you get a surprise pulp exposure. You glance at the clock and you see you've got 15 minutes left. Do you try to be a hero and rush a root canal? Probably not. You pull the ripcord, place a temporary filling to calm everything down. You explain the situation to the patient calmly and confidently and say something like, "We've discovered the decay was a bit deeper than we could see on the x-ray and it has reached the nerve. The best course of action right now is to place a medicated filling to soothe the tooth, and we'll schedule you back for the root canal to make sure we can save it." You've just masterfully turned a potential clinical and scheduling disaster into a well-managed two-step plan. The key phrase is always framed around patient benefit. The most important thing is that we get a perfect result for you. And to do that, it's best if we ... Over time, you will need to learn what you can take on and what you can't. I am 100% for pushing the envelope and maximizing daily production, but I see so many dentists that are overeager and they try to do things they're just not capable of yet. Understand your boundaries and know when and how to increase that production and push harder. The right doctor absolutely could do that root canal in the remaining time. But be honest with yourself, and if you can't, it's okay. Build the skills and the systems with your team so that you can handle that in the future. But know your limitations today. Your team is absolutely critical in all of this. Your assistant is your co-pilot, empowered to help you manage time and anticipate your needs. Your front office team members are your gatekeepers, trained and confident to enforce your scheduling policies. You have to operate as one cohesive unit, all dedicated to protecting the integrity of the schedule. When you master the art of identifying and containing these time sucks, and you develop the confidence to know when and how to pull that ripcord, everything changes. The stress level in your practice plummets for you and for your entire team. Your clinical work gets better because you're not rushing. Your patient's experience improves because they can feel the calm, focused energy, and they respect the doctor who prioritizes quality over speed. And an on-time day is almost always a more productive and profitable day. You feel in control, not like a victim of your schedule. So my challenge to you is this: look at your schedule tomorrow morning and identify just one appointment that has the potential to become a time suck, and then create a simple if-then plan for it. If Mrs. Davis starts talking too much, then my assistant will gently redirect. If that crown prep starts to look impossible and it will destroy your day, then I will stop and place a temp. Start small and see what a difference it makes. Now, thanks for being here, and let's keep working together to make dentistry fun, fulfilling, and rewarding. And subscribe so you don't miss the next strategy. And I'll see you soon.